And thank you very much for joining us. I am Yori Polari. My guest this morning, Dr. Amadeli Boyo, is a medical doctor and social commentator. Great to have you again. We had this joke just before coming on air, but we won't go there.
No, we won't go there.
We won't go there. And also welcome to Dr. Fasi Yusuf, not a medical doctor, a lawyer and communications consultant. Doctors, good morning. You're very, very welcome.
He's my brother.
He is. Brother in book.
No,
There you go.
Later.
Oh, how about you?
I forgot my mother is Chekiri.
You are Bamofin of Ijebu.
Yes,
But you
I
also
have a mother.
But you also cross over to. So there you go.
No, once your mother is Shakiri.
Yes.
Once your mother is Shekiri, you're Shekiri.
Yes.
And you are cousins.
Yes.
There you go. There you go.
We will discuss off camera.
We'll discuss the rest off camera. Because I have a serious matter that I thought we should air. It's not exactly new, but it's going to that statement that would have shocked a number of people. And let me just give a number. Let me give a little background. A little background before I land on my theme. Nigeria actually has, what? Record shows 75,000 doctors registered with the Medical and Dental Council of Nigeria. A lot of people would have known where we're going with this. 75,000 doctors. Now, checking it, it breaks down to 48% of this figure of 75,000 are working within Nigeria, and then it is said that 52% of them are working abroad. Now, worryingly, of this 48% working locally, it is said that 88% of that happens to currently be looking for jobs abroad. Now, that is what we hear. Okay, go on. WHO would like, if it could get it, a figure of 1 to 1,000 people, 1 doctor to 1,000 persons. That would mean that we would need something like 237,000 doctors just to fulfill that particular requirement. As it is, I think it works out at something like, statistics can break up a human being. But the figure we're giving is 2.27 doctors for every 10,000 people in Nigeria is the figure that we're seeing. So all of this, of course, everybody knows by now, is leading up to the Minister of Labor and Productivity, Dr. Chris Ngige, who happens to be a medical doctor himself, but was emphatic when he stated that Nigeria has more than enough doctors. As emphatic as to say that he could be quoted if you want. Well, since then, of course, there have been all sorts of commentary. Let me start with you, Dr. Boyo, because it's your area, even though it's everybody's area when it comes to healthcare. First of all, did you understand, or how did you receive the statement of Dr. Ngige? We actually watched the statement just before coming on air that we have a surplus of doctors.
Yes, in a way, I think it was playing to the gallery, with due respect to his senior colleague, because looking at him, he even compared the fact that they were going to bring in, when doctors are out of the country, there's a diaspora inflow, and that brings in more money. And of course, reports have had it that even now we're having more diaspora inflow as more than even the oil and gas sector now. But that's not the issue, because it still went further to say that it's good for them to go. It's good for them to go. And the key thing here, Yori, is that the Nigerian doctor is trained at state expense. 80% of doctors who graduate today are from federal universities. And if you remember, federal universities are tuition free. You just pay for boarding, you buy books, but they are virtually, I know people complain, we buy handouts, we buy them, but they are virtually tuition free. You can't train a doctor for the outside world. And these guys are trained, and all they think about is to leave this country. Right now, we have hundreds of newly qualified medical doctors who have no placements for housemanship. And the housemanship is a mandatory 1-year internship you must do before going for youth service. And the parade, in fact, you won't believe it, that doctors now do housemanship on what is known as supernumerary. It won't pay you because the hospitals can't afford to absorb them because of the money to pay them. So at the end of the day, we have doctors who can't even get the most basic jobs, internship. Then we have those who can't even get into the civil service because Ngige may be right in saying the civil service is not absorbing doctors because it has no space. But the truth is, he doesn't have the resources to pay them, or he doesn't want to pay them. Because if you go around this country, most primary health care centers don't have doctors. In fact, in some northern states, doctors are being recruited from Cuba, Pakistan, and different parts of the world. Now, if doctors are, somebody will tell me that in northern states, if you're a doctor, you go there, you work on contract basis. But that's not the whole story. The whole story there is that the training schools, the specialists, the Nigerian Postgraduate Medical College and West African Postgraduate Medical College, are having issues with having enough people even coming for training. Yeah, the training positions are getting smaller and smaller because the teaching hospitals can't afford to pay and have these people train. And most of the hospitals, like was said, December 31st, 1983, when this current president came in as a military president, that our hospitals are mere consulting clinics. So we are back to that state where the hospitals are dilapidated, infrastructures are down, so the number of people they can absorb is also very low. So it's like a vicious cycle. We can't employ because we don't have. We don't have because we can't employ. And so we have many doctors coming out and having no jobs. And how do? They want to sit for the PAB, the British exam. And the last exam that was done by the British Council, within the British Council here for Nigerians going abroad, it was huge. People paid so much to sit for the British exam so they can go and practice in the UK. Now, the minister said something that when they go there, they get better training, they get exposed, they get to be better skilled. They have more skills to come back. But the truth is, they're not going to come back. If they come back at all, they will not fit into the system. Why? Most people that go abroad, what they earn, you can't earn it here. So what we need to do really is to look in and be real with ourselves, to tell ourselves that we do not have enough doctors practicing in Nigeria, and we have many vacancies in the primary healthcare sector, in the secondary healthcare sectors. The doctors working in these sectors are overworked, and then we do not have the primary healthcare that are manned by nurses, community health extension workers, not bad in themselves, but we should grow to a level where we can have a medical officer in each of these local government primary care facilities, which we don't have. So at the end of the day, if we are going to be pragmatic and look at it from bottom up, you should have more doctors at the lowest level than at a tertiary level. You should have less doctors, highly specialized, super specialized doctors at the tertiary care level. So at the primary care levels, we should have the newly qualified doctors honing their skills and working in the primary healthcare centers. That's what we don't have now. So it's not true to say that we have more than enough doctors.
Okay. In fact, not just is it not true, according to what you've just said, but surely market forces should operate here. If we don't have enough, it's such a precious commodity. We need 37,000. We have only 75,000. Therefore, would this not be a coveted profession? The pay would be right up there. But that's not the sense I get from having been dealing with doctors, meaning, in programs like this, interviewing them. They're complaining about the remuneration that they get. Sometimes when some of them will share information with you, you're surprised that, what? It took you 7 years and you're not being real with me. And they say, yes, we are being real. It's nowhere like what you are saying with this, your economic theory, that because there are few, therefore the price will high. When they become as common as pure water, perhaps. So tell me, if you will, are doctors, the few that we have, so very highly paid that it will encourage any parent or any young lady or any young man to want to go into that field? Yeah,
doctors go into medicine not because of money. They go into medicine basically because of you have a passion to do it, and then your parents also. It's something of pride to say I have a son who's a doctor,
and it's a prestigious thing.
Yeah, and if you are good in school, you are good in sciences, you like to be an engineer, a doctor, So people go into that. But when they come out of school, the system it's in a way, if you notice, in the last many years, there have been always strikes about doctors going on strike.
That's right.
And what have they been going on strike for? For remuneration.
Among other things.
Among other things.
Because they're always complaining about the infrastructure, the health infrastructure.
So we find out that if you do not properly, as it were, provide the necessary equipment and make the place conducive to work, people will not be happy working, regardless of how much you are paying them. Why?
You are a working doctor. Oftentimes, sometimes we want you, but you say, "Look, we're sorry. You're sorry. Surgery. You can't." So it shows how busy you are. This claim by the doctors that the health infrastructure is nothing to write home about and actually shames their skill.
Yes.
That they can do a lot more, a lot better, if only they had the wherewithal. Government doesn't always like this when they hear this, as you know.
Yeah, but some states, we have to give it to Lagos State. Some states are really trying in terms of providing infrastructure.
Okay.
But of course, we know Lagos State is hamstrung by the fact that the population density is so high and there's very little, no matter how much you put in effort, people continue to overwhelm the system in Lagos. But thankfully, the private sector in Lagos, private hospitals in Lagos are even more than the state government hospitals. So the private hospital employs almost 60% of the doctors in Lagos. And so we have the state hospitals everywhere, local government, general hospital, Lagos State Teaching Hospital, and things like that. But the bulk of the cases in Lagos still rest in the private sector. And the point is, we have doctors today, one, who are roaming the street because the mandatory internship they have to do, which only about a few private hospitals are authorized to train interns. Then we have the Lagos State Teaching Hospital and the Lagos University Teaching Hospital in Lagos. Now, all these doctors come out and they don't have placements for housemanship, for the internship program. Then we have those who have finished youth service and they're looking for jobs. And the state government doesn't easily take up this because it says it is saturated. And saying it is saturated doesn't mean it has enough doctors. But it cannot afford to take in more doctors, because there are many general hospitals coming up in Lagos now. There are many primary care centers coming up in Lagos that should be manned by doctors. But will the state government be able to employ all these doctors within these facilities? What about other states? Adamawa State. How many doctors are in Adamawa State? We're talking of Lagos here that you still have some doctors. But there are some states in this country. I've covered fringes of Cross River, Benue, Taraba, Gongola states, and some parts of Plateau State working for a mission hospital. And I found out that I was the only doctor overseeing 116 health centers. And I do my visit to 2 health centers every week. And in 52 weeks, minus Christmas and other things, you can imagine I can only go like twice to a place. I've been to places before where I was the first doctor they'd ever seen in their lives, in this country. I've been to places before where my Land Rover Jeep arrived, and that was the first time they had seen a Jeep coming there. They had seen a vehicle.
This is Nigeria.
Yes.
Now, Fasi, with all of that background, I wanted to ask, since I know you keep a tab on all public issues, current affairs issues, what did you make of the statement of the medical doctor who also happens to be the Minister of Labor saying that we had more than enough doctors?
First of all, it is a mismatch. It's a misnomer to have a medical doctor overseeing labor matters. Number 2, the issue about governance in Nigeria leaves a sour taste in anybody's mouth, because the criteria used are always devoid of logic and reasoning, because political issues and primordial sentiments are brought in. I would not have expected the president to appoint Chris Ngige, a former governor, a medical practitioner, as labor minister. I mean, health is a social issue, and labor is management of resources. They are 2 different things. And therefore, again, the act of public speaking is something that you have to nourish. Most of our leaders, they regret their statements and they turn around to say they either quoted out of context, or the media was being mischievous, or something else. In this particular case, I think it was reckless on the part of the minister to have made such a statement, because all indices are pointing to the opposite direction. I'm involved because I have a daughter who is a medical doctor. She spent 10 years in medical school instead of the normal 6 to 7 years. And she's been battling with her residency program in the last 6, 7 years. And you know what that is? And the fatigue, what they go through, the mental torture and all the rest, can only be compared to what our people go through when they migrate from here to Europe through the Sahara Desert. The doctors and other medical personnel in this country are overutilized with less pay. They are not compensated, and people think they are doing them a favor if you employ them. Otherwise, in other places, and this is why you see nurses, medical doctors,
all of them
making waves in Europe, in America.
Yes.
As America is today, if you leave Nigeria and you are able to pass through the medical school there, believe you me, you don't want to come back to this country. Or perhaps when you are 60 or 70, you want to come back home.
To die.
Because you don't want to die there. Otherwise, there would have been no incentives for you to want to come back. And that's what is happening. You see our surgeons, they go to Saudi Arabia. You even see Christians go to Saudi Arabia that is hostile to their faith.
But I hear that, thank you. You're talking about hostile to their faith.
Yes.
But I learned, and I don't know how far this is true, that even that wave of going to Saudi Arabia, which everybody thinks as one of the most, lucrative. They say it's not so.
No.
Not necessarily so.
Excuse me.
That's
even in Britain too.
Quick enough, they're looking for a way out of Saudi.
Even in Britain too, it's lucrative, but it costs for a lot of responsibility.
And the cost of living.
Not even the cost of living. The type of environment that accommodates certain malfeasance, certain misdemeanor would not be accommodated in Europe, nor in America.
But you know how people specialize when in Rome, doing as Romans do.
I tell you,
they conform.
Notwithstanding, there are still some cases. I've been to all these places, and I'm in a position to tell you that no matter what, you have cases of infractions. But the point to be made is that we as a country, there's economic disequilibrium. The social sector is in disarray. I was opportune to oversee Minister of Health as a commissioner in Ogun State. It was not my primary responsibility, but I was the alternate commissioner for health. So I'm in a position to know the problems inherent in our health sector. The health sector delivery system in this country is appalling. And government has not really known what it should do with that. You see, in the past, some social scientists were even brought in as a minister of health. Although he did well, like he did Lambo.
Yeah. Because I was going to come to that, because you just said that, look, in your time in Ogun State, you were, as a commissioner, you actually, even if it was not a primary assignment, you actually oversaw the whole health thing. I was going to say that in relation to the very first point you made, which is that you were disappointed that the president had chosen a medical doctor.
Yes.
We've heard it say that medical doctors are to take this. Ministers are really to take decisions.
No.
But to take decisions, they don't have to be ignorant.
It is different.
They're there to take
it is different
decisions.
if you're an engineer.
Fashola is a lawyer, for instance.
Yes.
If you go by this
we
theory,
are not rating Fashola now.
No, we're not. But I was just saying that
Fashola,
I was speaking to the point that you're surprised that a medical doctor like Ngige was made Minister of Labour.
The health sector has been a very critical issue in this country. And there's hardly any period of 2 years you don't have either the Nigerian Medical Association or the nurses or the guild of this thing or the health workers union and all the rest at each other's throat or dealing with the government. So anybody manning that sector must be somebody who can really put on his thinking cap. Remember, even the present Minister of Health has had to fight many battles. His colleagues have been telling him that, look, when you were president or you were when you were the president of the medical, Resident Doctors Association at UI and all the rest, it was the same Buhari that booted you out of that place. And now
that's the Minister of Health.
The Minister of Health, that's what I'm saying. That's what I'm saying. That the Minister of Health himself has not to talk of somebody who is a medical doctor going to another field. So government should have thought of the critical aspects. I remember in the past, the military incursion into the political system was brought about because of the poor services in the health sector. You remember some of them would say, the hospitals have returned to a mere consulting clinic and all the rest. So if you're going to have that, and health is wealth. If a society lacks health care, that society can never be productive. And once there's no productivity within the system, it becomes difficult for any country to really thrive or to survive. So we have a situation where government will need to rejig the health sector. And Chris Ngige should have been called to order and to apologize instead of rigmaroling and trying to say he was quoted out of context, he did not mean this, he did not mean. I mean, there was no way he could have said something only for you to be finding justification for the stupid things you said by you.
Well, yeah.
Maybe yes. And you know, this is beyond medical doctors being surplus, like you said. We know the rate of medical tourism going on. A number of Nigerians trooping out of Nigeria to India, and even there's now a racket going on. India, Ceylon, Egypt, different countries for kidney transplants and other things here. Now, if we had enough here, and the system was able to absorb the number we have here in the area of providing very excellent health care, we will not be having all that. We know last year the president, or the year before, had to go to Europe for a health checkup. The problem in the country now is that it's not just that we don't have enough doctors, we don't have enough facilities, and then we are not utilizing the available facility, like power. There's nothing you can have in this country if you have a dialysis machine and you have somebody who is who has kidney failure and there's no light. What are you going to do about it? So power is still a problem. So what we are talking about now is not just releasing more doctors into the system, but every country in the world, as people are being produced, there's a scheme of knowing how this will be absorbed into the system.
Yeah, but and just like money, you can't write doctors into existence.
Yeah,
you can't just write them into existence.
So how many doctors are doing in the next 10 years? We should be able to plan that one out. And where are the hospitals going to absorb them?
And not only that, like you said, you see, there are issues that are critical to the survival of every sector, subsector, and component. For example, no matter what you have, if there's no energy here, there's no way we can be operating. So if there's no security, we cannot operate. So all these things have to be treated holistically. And there must be strategic and creative management, an innovative approach to most of these things. Because the way things are being done in this country, I've been told that the future is very bleak.
I certainly don't want to be seen as pummeling in any way Dr. Chris Ngige, but Fasi alluded at the beginning to perhaps this whole matter of public speaking, that skill, tact, diplomacy,
comportment.
Knowing how to speak.
How many politicians will agree with you that they have problem with public speaking? Because the art of politics itself is all about selling ice to Eskimos and coal to Newcastle.
Bamboozling people.
But the point is, I think for a long time, many politicians got away with the press. It's just now they are finding that the social media and the press seem to be taking them. I remember those they were coming to become, and the caterpillar and the bulldozer and the moonslide and landslide. People just laugh. But now people are now asking questions. What do you mean by this? I'm sure on getting home, his wife must have asked him. Did you really say that?
I just hope it doesn't cost Dr. Ngige, if, as is being speculated, the president has to dissolve and then form a fresh cabinet. If this will not be brought into contention, I don't know if we, as a society, if we need this kind of distraction or problem. Yeah, but because you don't need to be very, very enlightened or very, too many doctors in Nigeria.
The first place.
What is the other word for surplus?
Well, I say in Nigeria, there are no set criteria for bringing people, or appointing people into public office. It's at the whims and caprices of the president, subject to confirmation of the Senate, especially for ministerial appointments.
Yeah.
So we can only pray that public opinion will sway government or the president not to bring back such a character.
No, well, I didn't. Because as you rightly said, yes, you don't know what's going on in the minds of those who are appointed.
What struck me is being a minister of labor.
There
and
you go.
productivity.
And
if you say you
a
have
medical
surplus,
doctor.
if you say you have
It's a rare
surplus,
combination
if you say you have
in
surplus,
relation to the subject.
yeah, if you say you have surplus, you are locking the door.
Yes.
We can't employ any more doctors. We have too many doctors. You are locking the door.
And you are in charge of labor.
And you're in charge of labor. So at the end
And at
of
the
the
same
day,
time,
the
I'm
man
so
of the,
sure he didn't mean that. You know,
Are you a
are you
spokesman?
devil's
No, I'm
advocate
not.
today?
I'm not, but I'm a Nigerian. And I'm,
Because look at it,
and
let
the
me
way
give you
he
example.
phrased it,
Yeah.
the way he phrased it,
Yeah.
that, what you're there for saying by implication is that we can't employ anymore.
Look, what he said was simplistic, pedestrian, and devoid of logic. Saying bringing money from overseas, and how does that stimulate the economy? You send money to your parents, your parents are not working, they are spending. Is that productivity?
And beyond that, sir, if I may add this, at the end of the day, the question still boils down to what is the state of the hospital? If there are many doctors, let us see reflect. Abuja has Gwagwalada National Hospital.
It's not in charge of its own self.
All these hospitals are just there. How many hospitals should the country have? And how many of them, the national health policy starts with primary health care. And in primary health care, every local government in this country should have a functional primary health care service run by doctors and nurses, health workers, everybody there. And if you have malaria, for goodness sake, you shouldn't be going to a general hospital or a teaching hospital. You should be going to a nearby primary health care or your GP. Now, these people, if they are well staffed and they have the equipment, then the load on the teaching hospital would not mean, referrals, people that cannot be handled by the primary health care go
But
to the
that's not
secondary
what
health care.
happens.
No, that's not what happens.
what happens.
So we are saying there are too many doctors, and many states cannot run their primary health care scheme.
Yes.
Many federal medical centers are poorly equipped and understaffed, and then those that are even staffed have more on the it's a pyramid turned upside down. So you have more top people who are now directors of immunization, director of health planning, director of this, director of that, and you go to the civil service, the actual people carrying the stethoscope and seeing patients in the hospital are few.
Okay, we're going to go on a break now, but stay with us, please. We'll be right back. Okay, welcome back. And still on this question of Nigeria having more than enough doctors, according to the Minister of Labor, who also is a medical doctor. Oh, by now, you would have had phone calls. I'm sure a lot of you are waiting for the numbers to come up. I'm sorry, it's an Airtel problem. Airtel, we've had this problem with Airtel. They've been struggling with it since last night, I've been told, right into this morning. Airtel is not allowing you to phone in, let it be said. Now, that's the way that is. So they're still working on it. It just might be able to be possible before we go that Airtel will finally come online and then you'll be able to call in. But in the moment, Airtel is saying no dice. Now, let me come to you, Amadli, Dr. Boyo. Is there not a sense in which you could see this, you could look at this and say that, look, seen in this particular way, perhaps Chris Ngige was right?
Yes, playing the devil's advocate. Because what the system has done now is produce doctors without planning, without having a health structure that can absorb them. So you now produce doctors, and then these doctors cannot have, starting with health internship. So you release doctors from medical school every year, and there are only few designated teaching hospitals, federal medical centers, and general hospitals that
Can absorb it.
so that can absorb, that can designated by medical and dental council to train these ones during their internship.
Yes.
And then, like some hospitals have like 10, some are giving like 20, some are 2, you can only take 30. Now, these guys come out of school excited to work, and for 3 years, I have a niece for 2016. She's waiting for a house job till today. She's gone for interviews in Lut, gone for interviews in Latusut, everywhere. No placement since 2016.
When you doctors say a house job,
Yes, we're talking about internship.
Okay.
1 year between leaving school and going for youth service, you have to hone your skills.
And condition precedent to your being accredited as a medical practitioner.
Yeah, you can't get your license until you do that. You use a temporary license because you've not been supervised to actually work. You are good in the theory, you have done some practicals in school. Now, let somebody watch over you, apprenticeship in a teaching hospital. Now, we have so many people roaming about the streets, not having placements from Lagos to Maiduguri. So the minister will be right, saying we have support.
So in that sense,
so it's like creating artificial scarcity. It's like creating artificial scarcity.
Then there are spaces available properly designated places available to take them.
Yes.
So in that sense,
yes.
there's a surplus.
Yes. Then you leave youth service, and then you now want to work as a medical officer. You find out that, Federal Medical Center, Buti Meta, they are not employing. Federal Medical Center, Abeokuta, they're not employing. You go to Lut, they're not employing. Go to Lasu, they're not employing. Then you begin to call your uncle, who may be a former commissioner of health, who will now call somebody else to get you a job. And so,
the Nigeria grind
continues. But meanwhile, there are openings, there's inadequacy in the system. But these people are not employing because they don't have, one, they may not have the resources to pay them. 2, they may not have the capacity to absorb them. So you now say, there are surplus doctors in this country. Then 3, they pay. When you now get to a place, because there are so many people looking for the job and you don't have the job, you now say, well, can you do your housemanship on supernumerary? Which means you work for us because it's a mandatory 1-year program. We're not going to pay you. You come and work. And the person says, why should I be doing all this? Then he finishes the NYSC and comes back home. He goes to the various hospitals to do training and can't get a position for training. Then he starts thinking of going abroad.
Of course. Then they go abroad. Not just the doctors, the nurses as well.
Everybody wants to go abroad. Now, this same person that can't get a position here does the exam here and gets a placement in the UK before arriving there. And you get your salary, you are treated, you get the best of things working, everything seems to work for you, you are using laser to do surgery, and you are here still battling with 1970-something equipment.
Mind you, it's not that the doctors just walk out of Nigeria and just walk into a hospital abroad as well.
No.
It's not like that. They also have to go through
board exams. They have to pass those board exams, and then they have to also show that they graduated from the school year and have the medical, dental, and council certification too, before they now sit for the board exam and their transcripts go there. So at the end of the day, why stay at home after your parents have invested so much in you? You can't do your postgraduate program, you can't do the residency, you can't get a house job. So you can create you can create a situation where people are outside. It's just like water everywhere, but not enough to drink. So you have a situation like that.
Let me also add.
Because first you were shaking your head.
We are looking at the juicy aspect.
Yes.
There are so many medical doctors out there in Europe, in Americas, who are doing midnight jobs.
Oh, yes, and wish they can come back home.
Some of them are cab drivers.
But they're stuck.
Some of them are...
They're stuck because...
No,
what I'm saying is that it's just been proven how they're walking the street almost here, and then you say they go over there and they are very unhappy. But
yes.
They're stuck because they know if they pack up and come home.
Cases of depression, you see, there you get something to do. But again, in hygiene theory or in science, is it every job you do that will make you happy?
Fulfillment.
Do you get fulfillment? Do you get actualized? No matter what you are paid, you are not fulfilled. If you are not self-actualized, it will amount to nothing. The problem we have is that this country will not really sit down to think critically and creatively. What are the indices of development? How do we meet up with these indices? Like we have the 2030 Sustainable Growth Plan. What are we doing as a nation to get to that area? We failed in the Millennium Development Goals. What are the 2030? What are we doing? So do we continue to produce so that America that is developed, Britain that is developed, will continue to take the little that we have?
That's
And conversely, we bring in doctors from Sri Lanka, from India, from Bangladesh, and all the rest. What is really happening to Africa, to Nigeria?
and that is
And these doctors are not trained in tropical diseases.
It's an issue.
They don't understand our culture. They don't understand our way of life. And
Because
medicine is not all
You
about.
see some northern governors telling us they're going to India to recruit 50 doctors, 100 doctors, and 100. When Nigerian doctors are there, unemployed.
So how come, Amadili, that we are saying what we're saying now about the doctor population in Nigeria, and yet we are bringing in foreign doctors?
Yeah, because most of these jobs in the far north, like the core far north, are not accessible to Nigerian doctors, except you are going on contracts. Okay. So a Nigerian doctor gets a job in Kano, Katsina, or whatever, and is told he'll be renewing his contract every 2 years. Now the scale, or payment scale, every two years, a Nigerian doctor who is an indigene of maybe Jigawa State gets promoted every 2 years. So he starts at level 9. In 2 years, it goes to level 10, it goes to level 11, it goes to level 13. You come in as a contract staff, and you're not going to go in a career path. You're a contract staff, you're told you're going to pay you 250,000 a month for the next 2 years. So you cannot be a permanent secretary. You cannot be a director of health. You are just there as a contract.
No job enrichment.
It doesn't give you any fulfillment. Then they now go and bring a Cuban doctor that can speak English, or they go and bring a Pakistani or an Indian doctor who may not even have passed the medical and dental council exam. He's only coming here to start and try and pass the exam.
Well, they don't bring British doctors or American doctors.
Because at the end of the day, they don't have enough doctors there. They don't even have enough doctors there. And then can they afford it? So these doctors come here.
They don't have enough, apparently, if Nigerians are making beelines for
so
that place.
when they now come here, you find somebody saying, going to employ Sri Lankan or Ceylonese and then Indian doctors and Bangladeshi. And then the same hospital in Nigeria applies. There's no job. One, those guys are Muslims, and they want to employ a Muslim doctor. Those guys will come in, and they will be given accommodation. They'll be given everything they need to work. A Nigerian comes in, and he's not given the accommodation.
He's on his own.
There's a discrimination already in the system. And there are more doctors coming. There are more medical schools in the south of Nigeria, producing more doctors. And these doctors are ready to work in the north. But the point is that they won't give these doctors that work in the north job. I worked in the north for some years, and I know what it's like. When you're about to get to the top of the scale when you're getting to the top of being given a position, you are told it's a political position, and so they're going to give it to their own sons and daughters. So you remain in the system, and somebody you virtually trained or apprenticed under you becomes the head of the department because you are not from that state. After a while, you get tired because you can't see a prospect, you can't see a future. You find yourself leaving the country. So
it looks like, as I think Fasi was indicating it earlier, we need to put our thinking cap on, perhaps, from what you gentlemen are saying, and sort of figure this out. And then, this is why Dr. Chris Ngige, he's not a doctor of book. He's a medical doctor. Was in medical practice, I believe, before he decided to come into politics. I don't know. He couldn't be so far out in terms of his knowledge as to the current state of his profession.
No, there's something that happens to you, if I may interrupt you. There's something that happens to you when you become a politician and you get there. You have a brain transplant.
Fasi, you were going to say something about...
Yeah, I was saying, look, politics will not take over your faculty.
That's a brain transplant.
Yeah.
Yes.
Okay.
Because you are now trying...
Defending defensible.
You are now trying to justify your appointment, and you want to be a good boy before your boss.
But this will not make him a good boy before a president.
Interesting point. Because you come up with a statement like that. You're causing more problems for your boss.
You're forgetting what I just said. That you will be invited to shop. And you don't make noise when you are shopping now. And you are an advisor, you can only advise.
I don't have to take your advice.
Nobody is bound to take your advice. Yes. So if you're a minister...
but that was Obasanjo.
Even right now it happens. Look, it is not... Look, I've been in government. It's not everything the president sees and hears. And you know what? If you are the press secretary or special advisor to the president or to the governor may not have time to go through to flip through all the newspapers. the press secretary will only do press cuttings on issues he believes the governor should know about or the president should know about. If not even have time, maybe daily briefing. If
I think it was Obasanjo who famously said that he doesn't bother with Nigerian papers.
the special advisor, if he's that charismatic and good, we will have a briefing session with his principal every day, maybe 10 minutes, 15 minutes. Your Excellency, within the last 24 hours, this is what transpired. If he wants to listen, he listens. If he doesn't want to, when it comes to 9 o'clock news, China's news, TVC news, and all the rest, they block the boss. Then they bombard him with issues and all that. So he has no time to watch TVC, channels. Well, we have time to watch NTA because NTA will be sympathetic. So if you know how these things, the dynamics of power, how they play out in this country, you'll feel sorry for this country.
Those are things, and I think this is really the heart of the matter. Those are things that will have to be seriously addressed in the next administration. You know, otherwise, contrary to what they would want, people begin to get the impression that, are we sure these guys know what they're doing?
Yori, it's been happening since 1966. You remember, Tafawa Balewa was warned about the penny coup. Sadano Sokoto was warned about the penny coup. Some people got the hint.
Zeke was warned and he left.
They left. They said, no, it cannot happen. No, it's like, no. If you look at the history, the socio-political dimensions of administration, government in this country, you know that most of these things, we've always had warning signals of impending dooms. Even the Boko Haram we're talking about, there were warning signals. Until Yusuf was killed extrajudicially. If he had not been killed extrajudicially, we would not have gotten to this stage. The issues in Benue, forewarned, in Zamfara, forewarned, in Kaduna, forewarned. You'll be surprised. I mean, I'm not a prophet of doom. People are taking to the train now. They will start wheeling the trains. Just yesterday again, people were kidnapped.
Like God forbid, like in the wild west. That they used to, you know, remember the days of cowboys and Indians and Indians on horses robbing trains.
The Civil War, we had premonition.
Culmination of so many other
things. So because all these things
it's just that on, we don't put all that thing in cap and we believe that nothing will happen.
We live in this now.
When the present president was to be toppled in 1985.
August 27.
There were signals.
Yes.
Remember, Idegbo was not to go on that pilgrimage, but yet he went.
Yeah. So are we now saying that these things are like the grounds are clear? I give you an example. The Niger problem is going to give rise again to another crop of uneducated militants that will now want to cause mayhem. The area boy problem in Lagos, if not checked, is going to give rise to many other things.
Cattle rustling, the invasion of farms by the... I mean, look, all these things, they tell us that things are going to happen, and yet, we don't take preventive actions or proactive actions. We wait for things to happen.
Yet this situation, I mean, especially when you listen to the doctors, when the doctors come on, when they have mercifully, we haven't had any incident in recent times where the doctors come on and say, look, enough is enough. We are professionals. We know what we're doing. We know what to do.
They've done that several.
That is what I'm saying. It has been done severally.
Many times.
It has been done severally.
Many times.
But we haven't in recent times had it. Is why...
It's not because Lagos State government has been handling it.
You said so.
Yes, I mean handling it and trying to curtail the strike. But the federal government and the Lagos State and all doctors have been having strike over equipment, over salaries, over call allowance, over so many things.
In Lut, in the last 2 years,
yes.
How many times have doctors gone on strike in Lut? More than 5 times. Over facilities, over remuneration.
Maybe the press is tired of reporting.
You know, so unfortunately, Dr. Chris Ngige has now brought all of this back to the fore with his statement very recently that he's made that...
the problem is that...
Saying he should be quoted.
He did not articulate his position.
clearly enough.
Creatively,
Okay.
creatively and strategically. You should have spoken as somebody who's high up there. He was in service, he was an activist, he was a doctor, and a governor that was abducted and brought back, and who went back to medical practice, who tried to go to the Senate, and all that, and all that. So all his experience should have been amalgamated to talk straight to that point, not make that reckless statement.
He lacked discretion, if we use that word.
So
Which is the better part
you
of
as
valor.
you as a doctor are saying that it was on the reckless side.
No, that statement was uncalled for. And it was,
Because the man on the
it was
street
misplaced.
can't believe that.
It was misplaced.
The man on the
Because
street can't
nobody, even the woman in my 12, will not believe him.
This is the.
And then your principal is going to go out for medical checkup. Most people at top level of civil service.
We're
go out
talking
for
about the
medical
president.
checkup. Yes.
Yes.
Go out for medical checkup. And you have enough doctors here? Abacha died from ill health. Yaradua had issues with his health. And you have enough doctors here? Is it not cheaper to have brought in a liver transplant to Aso Rock than for Yaradua to have died in?
Well, how could that be?
Yeah.
When the wife of the president complained that the Aso Rock clinic was a mere consulting clinic.
But it's cheaper to have done that and pack your
And look at the National Theatre that was supposed to be first.
National Theatre, National
National Hospital in Abuja.
Yeah.
It has become a shadow of its former self.
Yeah, because of funding and supervision. So at the end of the day, we spend so much money going out. If the money spent on medical tourism can be directed to buying equipment and getting the best doctors, even these specialists who go and stay abroad are ready to work in Nigeria if they are paid.
In fact, as you gentlemen have said something about maybe the minister was faulty in his expression of the idea, because when you look at it, you know, you hear that Nigerians with high reputations abroad, and Nigerian doctors in the US, maybe in the UK, but particularly in the US, so much so that those ones come back from time to time wanting to give back, to do, is it outreach that you call it?
Intervention,
all those kind of things. And but to say what was said, well, I guess we have to leave that there. We just wait for, maybe he'll be, because Fassi said maybe he'll be in the next cabinet, but certainly I imagine that there'll be a sort of talking to. So look, we don't need all the problems, all these extra problems. First of all, we have the issue of we are not able to do all that we want to do. Now you complicate matters by suggesting.
Like I said, it also mean that there's surplus.
You have issue with security. The social sector,
terrorism,
unemployment, the social issues, unemployment, health, and all the rest. So, where are we? Are we going to retain the same set of people to continue with the vicious cycle or what? Or are we going to bring in people who are ready to put on their thinking cap? People will be creative, people will be innovative, and will be agents of change, and they will be able to engage in transformational management.
Well, maybe the good doctor can explain himself better. Perhaps people are misunderstanding him and maybe following that apologize, probably, because a lot of people would have been stunned. In fact, where the original interview occurred, the lady, I think it was Mokwe, she was virtually like, what do you mean to tell me? I mean, you don't need to be a student. You don't need to.
Freudian slip. It could just be that he himself had always felt like that, so he just came out of it from the abundance of the heart.
If it was a Freudian slip,
yes,
he then said, quote me. Quote me. I'm telling you, quote me.
Yes.
And all of that. But,
we have not said much about it, but he has his own syndrome, so we can excuse him. Ngige. Don't worry, I won't tell you much about that.
Okay. I think we're going to have to leave it here. Thank you very much, gentlemen. Dr. Fassi Yusuf, lawyer and communications consultant, and Dr. Amadili Boyo, is a medical doctor and a social commentator. Thank you very much, gentlemen, for coming on the program. And let me apologize once more for your not being able to call in today. I said Airtel is the line. Is the phone line. They've been working on this since yesterday night. It hasn't happened. We thought it might happen before the end of the program. Well, apparently, Airtel no go agree. Perhaps Airtel will be up tomorrow. In the meantime, I'm Yori Folarin. Bye-bye for now.